Hello and welcome to eMedicore Patients Corner Series. Today's discussion is Urolift for BPH, or benign prostatic hyperplasia. Urolift is a new, minimally invasive treatment that alleviates BPH symptoms. It delivers immediate results, rapid symptom relief, preservation of sexual function, quick return to normal activity, and a small likelihood of a catheter placed after the operation, and an increased quality of life. Here we see two diagrams, one showing a normal prostate and one showing an enlarged prostate. Urolift was created by the FDA in 2013. It was designed to open the prostatic urethra, the inside of the prostate, without applying incisions, cuts, surgical resection, or scraping of the prostate, or thermal ablation, heating, to the prostate. The doctor places small permanent implants into the prostate to lift and hold the enlarged tissue out of the way, relieving pressure on the urethra and allowing the urine to flow. The obstructed prostate lobes are pushed aside by small Urolift permanent implants. The implants hold the lobes out of the way like tiebacks on a window curtain. Here we have a diagram showing the Urolift procedure instructions. Here is a video showing the Urolift procedure instructions. The Urolift system treatment has consistently demonstrated an excellent safety profile. Perioperatively, Urolift typically requires lighter anesthesia, either local anesthesia and oral sedation, or intravenous conscious sedation. Then TURP, transurethral resection of the prostate, or laser, typically general anesthesia. Bleeding is also much less than in a TURP, transurethral resection of the prostate procedure. Post-operative catheterization has been shown to be 30 to 35% compared to standard protocols for TURP, with a mean duration of 0.9 days compared to 1 to 5 days for a TURP. Preservation of sexual function. In all studies to date, there has been 0% incidence of de novo, sustained erectile dysfunction, or ejaculatory dysfunction. Here we see a benefits comparison chart which compares the Urolift procedure to other treatment options. The alternatives, though they may not be as beneficial as the Urolift system, are TURP, transurethral resection of the prostate, laser, thermotherapy, and medications. Most common adverse events include hematuria, blood in the urine, dysuria, burning on urination, micturition, urgency, sensation to urinate frequently, pelvic pain, urge incontinence, leakage of urine with urgent need to urinate. The possible side effects include immediate healing response and tissue inflammation, urinary retention, routine catheterization for days, 4 to 6 weeks of irritant voiding symptoms, potential permanent sexual dysfunction, including erectile dysfunction and retrograde ejaculation, or dry orgasm. Most symptoms are mild to moderate in severity and are usually resolved within 2 to 4 weeks. Your urologist will do tests to make sure the anatomy or configuration of your prostate does not have a median lobe, a lobe in the middle of the prostate, and size of your prostate is not very large before doing a Urolift procedure. You should let your doctor know of any and all allergies and medications that you are currently taking, including over-the-counter medications, such as aspirin, ibuprofen, naproxen, Blood thinners. You should ask your doctor when you should stop taking blood thinners before the operation. You should take antibiotics before the procedure as prescribed by your doctor. You should use a fleet enema medication to be instilled into your rectum to increase bowel movement and cleanse the rectum, as directed by your doctor, usually a few hours before the procedure. Normally, when the procedure is performed under local anesthesia, you can have a light breakfast and or light lunch. It is usually recommended that you have someone drive you to and from the procedure location. You should let your doctor know if you are taking any medications, for instance aspirin, which you should stop immediately. The primary contraindication to Urolift is an obstructive or protruding median lobe of the prostate. Additional contraindications can be found in the Urolift system instructions for use. After the procedure, go home and rest. Drink plenty of water. Take any prescribed antibiotics or medications. Avoid any strenuous activity including sexual activity, sitting for an extended period of time, and exercises including jogging and lifting. Call your doctor if you have a fever higher than 101 degrees Fahrenheit, are unable to urinate, or have severe bleeding that is thick like ketchup.
eMedicore, core medical education for everyone,
from everywhere,
forever free.